So let's talk about HCG and testosterone replacement. So when you're going on hormone replacement therapy or testosterone replacement therapy, some doctors use HCG and some don't. Now, I don't know why some don't. They might not be educated. They might not believe in using it along with that. I understand both parts. That's fine. Here at Type Medical Center, our physicians and medical providers use HCG along with testosterone replacement therapy. And they use this because when you take testosterone in, whether it's oral, whether it's an injectable, whether it's a cream, you're putting exogenous testosterone in the body. Your brain recognizes this exogenous testosterone in the body. It's not dumb. It's on top of it. It's the best machine ever created. So when it focuses in and it realizes that, listen, we have this exogenous testosterone. The signal from your brain to your testicles, right? The brain tells the testicles, hey, listen, we've got this in our body. We don't need you to work because that's where your testosterone is getting made down there. It's getting produced. And it's getting shoveled through the body at that point. So when it shuts down, your natural production is getting shut down. Now you're replacing the testosterone that's getting shut down with the exogenous testosterone you're putting in your body. So if you're getting a high level when you're doing a lab test of total testosterone or free testosterone, naturally, without replacing it, you don't want to mess with those levels. Guys, I don't care how big and fast you want to get. It's not going to make you Arnold Schwarzenegger overnight. You're going to have to do this for a long period of time. You're going to have to eat. You're going to have genetics. You're going to have to train. You're going to have to do the right things. And I'm telling you guys, I've seen numbers come back at 10,000 and above. And the guy was like 190 pounds. It didn't matter his level of testosterone. He wasn't getting bigger faster. I promise you that. So it's not always about the amount that you're doing, okay? So on the exogenous tip, when it shuts down that signal to the testicles get shut down. What happens to the testicles is they shrink. They go into atrophy. This does not feel good. I know from experience. I know a lot of other patients do too. You don't want to have shriveled prunes down there. Aesthetically, you don't want it. Physically, you don't want it. I promise you. A lot of guys tell us when they call in, some anyway, I don't care about fertility because I know HCG is for fertility. Well, it's not just for fertility. It's to make sure that your semen production stays up to par too as well. You don't want your semen production getting shut down all the way or going and getting suppressed. You don't want that. So you want a full effect. You want a nice aesthetic look. I promise you your partner will probably like that too as well. So trust me, HCG is the way to do it. Now, what does HCG do when you're on testosterone replacement therapy? Because we know that putting the exogenous testosterone in the body is what we need to do to replace the levels if it's low. So if it's low and deficient, we're putting testosterone in. That's raising the level of testosterone, right? We're there. We got that good. Now, the signal gets shut off to the testicles. What do we do at that point? That's when the HCG gets introduced. That introduction of the HCG will mimic the signal of the luteinizing hormone down to the testicles to make sure that they start saying, hey, listen, we still need you to produce, and it produces. Your natural production never gets shut down at that point. Your semen production is still up to par. So when you're getting this all done, you're getting a great effect. Mood enhancement, it's going to get physical enhancement. You should get some better benefits on HRT with HCG. And like I said, you won't get no shrinking in the testicles. You won't get no tightness. It won't be uncomfortable because I'm telling you, it can get uncomfortable. So at that point, don't have them shrink all the way. So I hope that covers some of your questions.